Hello and welcome. Today we're diving into a complex and often misunderstood condition, inflammatory bowel disease, or IBD. We'll explore what IBD is, what causes it, how it's diagnosed, and what can be done to manage it, providing a comprehensive overview of this chronic illness. The exact cause of IBD remains a mystery, but it's generally accepted that a combination of factors plays a role. These include genetics, immune system dysfunction, and environmental triggers. It's not simply a case of bad luck or poor diet, but rather a complex interplay where the immune system mistakenly attacks the digestive tract, leading to inflammation. While heredity plays a role, as IBD tends to run in families, not everyone with a genetic predisposition will develop the disease. Factors like diet, stress, and exposure to certain microbes are thought to act as triggers in susceptible individuals. The pathophysiology of IBD involves an abnormal immune response in the gastrointestinal tract. Normally, the immune system defends against harmful invaders like bacteria and viruses. In IBD, however, the immune system misidentifies harmless substances in the gut, or even the gut lining itself, as threats. This triggers a chronic inflammatory response, leading to damage and ulceration of the intestinal walls. The inflammation disrupts the normal function of the digestive system, causing symptoms like abdominal pain, diarrhea, and bleeding. The specific areas of the gut affected and the type of inflammation present vary depending on the specific type of IBD. IBD affects millions of people worldwide, with incidence rates varying depending on geographic location and ethnicity. It's more common in Western countries, and incidence is rising in newly industrialized nations. While IBD can occur at any age, it's most frequently diagnosed in adolescents and young adults, between the ages of 15 and 30. There also appears to be a smaller peak in diagnosis later in life, typically in the 50s and 60s. While both men and women are affected, some types of IBD may be slightly more prevalent in one sex than the other. Understanding the epidemiology of IBD helps researchers identify risk factors and develop more effective prevention and treatment strategies. The signs and symptoms of IBD can vary widely depending on the location and severity of the inflammation. Common symptoms include persistent diarrhea, abdominal pain and cramping, rectal bleeding, weight loss, and fatigue. Some people may also experience extraintestinal manifestations, meaning symptoms that occur outside of the digestive tract. These can include joint pain, skin rashes, eye inflammation, and liver problems. The symptoms can fluctuate over time, with periods of active disease, called flares, followed by periods of remission, where symptoms subside. It's important to note that these symptoms can also be associated with other conditions, making accurate diagnosis crucial. Diagnosing IBD typically involves a combination of medical history review, physical examination, and diagnostic tests. Doctors will ask detailed questions about your symptoms, family history, and any other relevant medical information. Blood tests can help detect signs of inflammation, such as elevated inflammatory markers, and rule out other conditions. Stool tests can help identify infections or parasites. However, the most important diagnostic tools are endoscopic procedures, such as colonoscopy and upper endoscopy. These procedures allow the doctor to directly visualize the lining of the digestive tract and take biopsies, which are tissue samples that can be examined under a microscope to confirm the diagnosis and determine the type and extent of inflammation. Imaging techniques, such as CT scans and MRIs, may also be used to assess the bowel and identify any complications. IBD isn't a single disease, but rather a group of related conditions. The two main types are Crohn's disease and ulcerative colitis. Crohn's disease can affect any part of the digestive tract from the mouth to the anus, and inflammation can occur in patches, affecting some areas while leaving others untouched. Ulcerative colitis, on the other hand, is limited to the colon or large intestine, and the inflammation is typically continuous, starting in the rectum and spreading upwards. There is also a condition known as indeterminate colitis, which is diagnosed when it is not possible to definitively classify the IBD as either Crohn's disease or ulcerative colitis. Differentiating between these types is crucial because treatment approaches may vary. While there is currently no cure for IBD, various treatments are available to manage symptoms, reduce inflammation, and improve quality of life. Medications play a central role in treatment and can include anti-inflammatory drugs, such as aminosalicylates and corticosteroids, immunosuppressants, and biologics, which target specific components of the immune system. Diet and nutrition are also important aspects of management. Some people may benefit from dietary modifications, such as avoiding certain trigger foods or following a specific diet recommended by a registered dietitian. In severe cases, surgery may be necessary to remove damaged portions of the intestine. Management of IBD often requires a multidisciplinary approach involving gastroenterologists, dietitians, surgeons, and other healthcare professionals. Unfortunately, there's no guaranteed way to prevent IBD. given the complex interplay of genetic and environmental factors. However, adopting a healthy lifestyle, including a balanced diet, regular exercise, and stress management techniques, may help reduce the risk. Avoiding smoking is also important, as smoking is associated with an increased risk of Crohn's disease. Some research suggests that certain dietary patterns, such as a diet rich in fruits, vegetables, and omega-3 fatty acids, may be protective, but more research is needed in this area. Ultimately, focusing on overall wellness and working closely with a healthcare provider is the best approach to minimizing risk. The prognosis for people with IBD varies depending on the severity of the disease, the individual's response to treatment, and the presence of complications. While IBD is a chronic condition, many people are able to achieve long periods of remission with appropriate management. Recent research is focused on developing more targeted therapies that can precisely modulate the immune system without causing widespread side effects. Researchers are also exploring the role of the gut microbiome, the complex community of bacteria and other microorganisms that live in the digestive tract, in the development and progression of IBD. Understanding the microbiome could lead to new strategies for preventing and treating the disease. Personalized medicine, tailoring treatment to an individual's specific genetic and environmental profile, is also a promising area of research that could revolutionize IBD care in the future.